Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about the relationship between an ankle sprain and a common muscle that tends to become irritated as a result of the sprain, referred to as the peroneal muscle. And so essentially this muscle, there's two muscles that make up the peroneal, and essentially these muscles, they attach onto the fibular head, which is essentially one of the muscles that is just below or makes up the knee joint. And it essentially, the muscle again attaches there, it crosses the ankle joint, and then it attaches onto the far portion of the foot. And essentially, when we go into a very specific ankle sprain position in which the foot is pointed and it goes inwards, right? The body will naturally try to protect itself from essentially rolling, right, the ankle by contracting this muscle. So this muscle essentially, when it contracts, it does the opposite action. Instead of going into what's referred to as plantar flexion and inversion, well, the job of this muscle is to evert, and actually it also does a little bit of dorsiflexion. So you can appreciate why, if we're trying to protect ourselves from this ankle sprain position, so to speak, that muscle would have a very forceful contraction. So in a lot of cases, I've seen a lot of patients who have presented like an ankle sprain, right? We've been rehabbing, and essentially their rehab reaches a plateau in which they're still experiencing pain, typically with, in a lot of cases, with some sort of impact type of activity, or with walking, or if they're having to push down. And what I found in a lot of cases is that this muscle has also developed some form of tendinitis as a result of its large contraction that it occurs to, again, try to protect the ankle joint. And so in a lot of cases, when a patient has an ultrasound done, let's say, to see if there's anything structurally wrong in the ankle joint, in a lot of cases what we'll find is that particular tendon coming off of the peroneal is actually inflamed. And it's one of the reasons why, unfortunately, when we're working on strength and we're working on stability and balancing, if that muscle, if it's inflamed, essentially, well, it's not going to get any stronger, and essentially it's going to plateau. So again, an interesting area, an interesting muscle to look at if somebody has an ankle sprain, a persistent ankle sprain, which is plateauing and isn't getting any better. Thanks again for watching, and have a great day, and please subscribe below. Take care.